News First, Newsline.
Hello there, very good evening and welcome to another edition of Newsline, coming to you live and direct from our News First studios here in Colombo. Your usual host, Faraj Shaukat Ali, is out for the day. I'm Charlene Benedict and I will be sitting in for him. Of course, the COVID-19 pandemic is all that we hear about, it's all that we speak about. But instead of just understanding what's going around us, instead of just watching the news and feeling down and out because many of us are stuck in our homes or under quarantine or under lockdown in certain areas, it's important that we understand how we need to respond to this crisis that we're currently facing. And as health experts opine, this new normal that we're in right now, where curfews and lockdowns and quarantine becomes an everyday thing that can pop up any time of the year, we really need to understand how we need to cope and live in this new normal. Now, to discuss these matters, we've got with us today a very special guest, Professor Atula Sumatipala. He is the Director of Research and Development at Health and Social Care. He's also a Professor of Psychiatry at the Keele University, and he's the Chairman of the National Institute of Fundamental Studies. A very good evening, Professor, and welcome to the show.
Very good evening to you, Shalan.
Professor, now we see a lot of discussion going on whether a community spread of this disease has begun, whether it's still not a community spread. There are caricatures going around on social media. But what seems to be lacking is a proper understanding on the responsibility that each and every one of us have in responding to this pandemic. Is it only the authorities that really need to face this thing head on? How does the responsibilities pan out?
Not really, Shalan. I'm glad that you brought this issue of, splitting hairs, I would call it, about whether this is sort of their social spread or not, which is for the authorities to discuss in closed doors, not for the public. I would also start by thanking you for giving us this opportunity. Why I say us, it's not just me representing here as an individual. I have a huge network of intellectuals, practitioners, so I have consulted most of them. We keep on ongoing discussions, updating our knowledge, current things. So I'm representing a group of people who has actually very clear understanding of what's going on and approach on a strategic way, particularly to empower the people. Now I'm very mindful, today I'm talking to middle class, upper middle class, English speaking, social strata, plus a group, possibly a strata of English speaking, young, talented youth. So I really want to concentrate on few things. So therefore, let's discuss, Shalan, what is most important from the public point of view. So let me start by saying our duty, the outcome from today's discussion for me would be to educate the people who are watching this program. Educate in the sense I'm not trying to teach them, sharing some information so that they can grab some fundamental basic principles they can apply on their day-to-day life, and also to help others to understand this. Thereby they become more aware of the real ground level issues. Why I say this, we are a very literate country. Our literacy rate is very high, but our health literacy doesn't, Shalan, necessarily reflect that. People may be very educated, but having said that, the health literacy could be different. But on the other hand, the other challenge, as I told you before we started the program, 90% of research in this whole world come from 10% in the world. That's the Western countries. So initially we actually researched 6 leading journals in mental health, and we thought it because mental health, but then we researched 6 leading journals in medicine. So it's the same. So we call this 90-10 divide in terms of scientific knowledge. Now when it comes to COVID, even that expertise is not available, because COVID is a new challenging pandemic which we are seeing.
So we're still learning as we go along about the ill effects of the COVID-19 pandemic.
Globally we are learning.
Right.
To give you a classic example, you would remember at the very beginning even the WHO said not to wear the mask. Now it's changed. I'm not surprised, because when knowledge gathers, we can't live in the past. We have to change our strategies, we have to change our tactics, we have to change our operational ways of operating. So similarly, at the very beginning, the WHO said social distancing. Then they changed the word physical distancing. However, some people still use social distancing. So this is a evolving science where still a gap in the knowledge. It's worse than 90-10 divide, and we are actually facing that. To complicate the matter, unfortunately what happens, there are a lot of, again, this is not my interpretation, the WHO coined the term infodemic. So information pandemic in the world, where there is disinformation and misinformation. So disinformation is deliberate spreading of completely wrong things for an ulterior motive, which is harming. So on top of the virus, we are having to face that. Then misinformation.
It's a pandemic and an infodemic.
Yes.
Simultaneously,
which is making things worse, because the reason is, Shalan, this is the first pandemic in the world we are facing after all this IT, information, escalation of knowledge using information technology, Facebook's mass media, then social media, all that. The other thing is misinformation. To give a good example, when the Venice was empty, so there were rumors to say dolphins were all over, then ducks were going in the lake.
We saw those rumors spreading in Sri Lanka as well on miracle cures for COVID-19. Some claimed that consuming alcohol could prevent a person from contracting the virus. So there were many instances like that. But Professor, I'd like to ask you one question. Now, with the gaining of new knowledge, you said globally we are learning about this pandemic. Is Sri Lanka really keeping up to the knowledge that is being gathered globally? And are we changing fast enough to respond to this pandemic?
Absolutely. Let me explain it this way. Let me finish first thing, which we were discussing about. So this disinformation and misinformation actually distract us from knowing the truth. To answer to your question, yes. Why I say yes? When it comes to this pandemic, Shalan, we have specialists in this country called public health experts. Some people call them community medicine, but community medicine, public health is much wider thing. We have got over 120 consultants, specialists, trained, experienced in the whole country, just in the health system, and the chief epidemiologist is one of them. In addition to that, all the universities in this country has professors of public health, right? So they keep on updating their knowledge, sharing with other colleagues, and even the chief epidemiologist, I know him personally, because Dr. Sudat Samaravira was his MD and PhD, both were supervised by me. In spite of his very busy schedule, he keep the information up to date. But the difference here is, Shalan, our intellectuals, our educated professionals in this country doesn't grab the information as it is. They grab the international information. They are very well trained. They are experts who can adapt that information to suit our country. Because as you know, as I told you, even the information coming from the West, the 10% of the globe, doesn't necessarily fit us. I'll tell you why. Now, you recently heard Sri Jagadhanapura University, Professor Nilika Malavige and Dr. Jeevandra, their team, found out that the Sri Lankan current strain of virus is different from the previous one. How did they know that? They did research. Research is going on in Sri Lanka. And I can guarantee you, our professionals are doing their best to update their knowledge. Of course, there will be gaps, global gaps, as well as due to time constraint. But I am confident enough that's not a decisive factor in the management of current pandemic. Things are happening. So they are being educated, because again, there are deliberate efforts to keep up to date.
Right.
So to answer your question, yes, I do believe we have the know-how, we have the people, we have the system to do it. But whatever they do, whatever strategies they adopt, whatever the operational system we have in country, finally it boils down to the public to take into their hands their duty. So therefore, even our top level intellectuals, professionals, learned people, they have to transmit that knowledge into the public in a way they can understand, grab and adhere to them as well as practice. Now remember, Shalan, somebody can be educated, somebody may be knowledgeable, but that knowledge or the education doesn't necessarily translate into behaviors. So as a psychiatrist, I know this, right? So education is one thing, knowledge is another thing,
Behavior is something else.
behavior is something, practicing that is a completely different things. So what we really need to do is, rather than trying to go into too much of huge intellectual discussions, debate which confuses people, or sometimes concentrating on deliberate disinformation or misinformation, get to basics. Back to basics, that's my advice to everybody when it comes to the public. What are the basics? Wash your hands, not just wash your hands, more than 20 seconds.
20 seconds, yes.
Right? Many times a day. Use
Hand sanitizers.
hand sanitizers, right? Wear your mask, which is right now in my pocket. When I came, I was wearing it. Keep your physical distance, not social distance. Those three together. Okay, so that's very important to do that. And if you can do that, the classic example why I say this, the thing is, people need to understand, the IDH hospital had over 1,700 patients. But all the doctors, all the nurses, and even the so-called mine employees, I hate this word, I don't call them mine employees, they are respectable members in the health team. They adhere to the right health standards, and they have given an example of how to behave, practice healthy practices when even treating people, and they have managed to do that. So therefore, that's a very good classic example people can learn from it. Back to basics, people adhere to that, and if you practice those, you think about what you could do for the benefit of your health, benefit for your immediate family members, your friends and the society. This would be a much relatively easier task for the health authorities, the forces
And the country as a whole.
the political leadership and the country as a whole to get over this. Remember, Shalan, this is a global pandemic. We shouldn't have unrealistic targets of saying we can make it zero. It's not going to happen.
Professor, we need to cross over to a short commercial break now, but of course our viewers have sent in a bunch of questions that they would like me to ask you, and I will pose those questions to you. So stay tuned for that segment after this short commercial break. Don't go anywhere. You're watching Newsline.
News First, Newsline.
Welcome back. You're watching Newsline. We're currently in discussion with Professor Athula Sumatipala regarding the best way that we of the community of Sri Lanka can live in the new normal that has been brought about by the COVID-19 pandemic. Professor, before the show you were speaking with me, and we were speaking about quarantine centers and how mandating people to either go to a quarantine center and forcing them is not really the right way forward, and that now things have changed and people have been given a choice. If they want, they can stay at home, or they can choose to go get themselves quarantined at a hotel or a similar facility. So following up from the discussion that we had before the break, you were speaking about the rights of the people and how we should keep up with knowledge that has been gathered from the world, especially the World Health Organization. We have got a question from one of our viewers regarding a specifically delicate subject that we have been discussing for quite some time now, but it's really hard to wrap ourselves around the logic behind this, because the World Health Organization has announced that it is all right for people to be buried. However, in Sri Lanka, we follow a strict rule of cremation only, which is at odds with certain communities in the country. And that is causing a little bit of a stir in the country, even in the political scene. How do you think we should move about
Okay,
it?
so right-based approach. Now, I have a background in medical ethics. I have contributed to ethics, the WHO, particularly in relation to managing pandemics, epidemics and things like that. The fundamental principle in public health and ethics is the greater good for the majority. The whole public health approach is that rather than concentrating on individuals treatment, the public health thinks about the broader way of dealing with it. Is the ethics is also same. Now, to put things in context, again when it comes to even in the Western countries where individual rights are held higher than the
community rights, they, when it comes to public health, they take the approach of greater good for the majority of people. Now we are a different country, we are a different society, particular regions. Rather than the individual, society come first. I am trying to give a broader basic principle of how. So when it came to quarantine at the very beginning, so everybody was taken into quarantine centers. There was not much of a choice in the context of limited knowledge. But quite rightly now the choice has been given for people to stay in the indoors. But then while they get their right, they also have a responsibility and duty to adhere while safeguarding their rights to protect other people, right? So all this has to come like that. And again, having said that, quarantine is a choice. If somebody is not having adequate space, they still have the choice to go elsewhere. Even people who can be quarantined at home, if they think because of their loved ones, elderly people, they want to go to a hotel, those facilities are there. So that's the basic broad approach where they have followed. The sensitive question, put it this way, I have always fought, I am somebody even after tsunami, fought for dignified burial, where people didn't get even a coffin, they were in mass graves. So even in the current context, I think the dignified burial is there. The challenge here is the cremation or not. Now again, the WHO recommends that, I am very aware. So the juries divide on this issue, but when it comes to Sri Lanka, there are valid arguments, because geology is not my subject. I don't know how depth the water bed is in Sri Lanka. But there are people who say the water bed is different, there is a chance of contamination. So if there is a doubt of public good from any step, then it's good to go for a broad approach. Now for example, the best case scenario was if we didn't have COVID, but we have COVID. Everything we do, whether it's quarantine, whether we admit people, whether we bury people, there are advantages and disadvantages. Of course, at times individual rights, at times group rights may be relatively get a relatively less priority. So put it that way. So the best thing is we can revisit these concepts, the authorities, and we have to come to a consensus. And I will tell you one thing, for human beings, and particularly when it comes to ethics, ethical practices, there cannot be absolute answers, because ethics is about moral rights and wrongs which are not universal. And some jurists define that morality is an empty cup that you can fill anything into.
And remember, in this country, we had a 30 years of war. We still have people, children, parents, wives, who has not seen their loved ones, even the dead body. So that was a huge sacrifice. So I am not dismissing the psychological impact of not having to go through a grief process. We are a country, we are a nation which has a huge, very, very rich way of grieving. Very rich way of grieving as opposed to the West. However, so therefore there is a mental health impact, not mental illness, that certain things cannot be done. But then if there is a slightest doubt scientifically, so we are talking about still 25 deaths. I am still not undermining, even one death is one death, which is very important.
One death is too much.
25. So people who are believing, the great majority, if they say, okay, giving a burial is risky for the great majority of the society, So that is where I stand. So even if one of my loved ones, get affected through this, I'll be very affected, but I will take a national stand, even for myself.
Professor, we're in the final few minutes of our show, and one thing that is generally downplayed in Sri Lanka is mental health. We've been discussing this for quite a long time because people are cooped up in their houses, they're frustrated to a certain degree, people don't know how to get how to make ends meet to feed their children. So in the final few minutes of this show, is there any advice that you can give these people? How can they really cope with this stress?
Yeah, I mean, coping is a relatively difficult thing to answer. Some people cope by talking, some people cope by mixing, some people cope by not mixing. And I do agree, COVID would have a certain amount of impact on mental health well-being as opposed to mental illness. I strongly believe, we don't have figures, we are still following up these affected people. In terms of figures, I don't think huge numbers will get mental illness. Now even after tsunami, the Western pundits were saying we will get post-traumatic stress disorder 70%, 80%. We did island-wide mental health survey of 10,000 sample, where Sri Lankan PTSD was only 2.8. But on average, 10% of people will get mental illness. But the most important thing is mental health and well-being. There are many different ways. It's very difficult to tell everybody in 5 to 10 minutes how to do it.
You actually have about 1 to 2 minutes.
Yeah, so it's very important to talk to other people. Keep your networks, phone calls, Zoom, rather than going to Facebook and going misled by disinformation. Keep in touch with other people, ventilate your feelings, share your information, watch television, relax, entertain, listen to music. All that is very important, and I'm pretty sure with the extensive network of mental health facilities in Sri Lanka for preventive aspects, particularly Family Health Bureau, Health Education Bureau, there will be a lot of things to come. And before we finish, I want to give a message.
Yes.
Every individual, while you think about your mental health, one way you can help other person's mental health is ensuring that even the people who have relatively less means of surviving this, financially help them. You can look after your less capable people who are employed by you by supporting them financially, by cutting down some of your comforts, or your immediate neighbors, or contributing to the national fund to try and help. So financial insecurity can promote mental well-being because people will be very worried. So if you get, because the basic needs are basic needs, so that's another way people can contribute to other people's mental health by reassuring that they have something to eat on the next day, and you also get a mental satisfaction from that
you help someone else.
Absolutely. And all this stress thing is a relative thing, and there's a lot to do. It's very difficult to discuss all this in very limited
Definitely,
time.
Professor. Time is of the essence, and we've run out of time, unfortunately. But of course, Professor, thank you very much for joining us on our show and speaking on the solutions instead of focusing on the problem. And our message to our viewers out there is stay at home, stay safe. Let's make it through this together as one nation. Thank you very much for tuning in. Take care and God bless.